If you could please introduce yourself in the chat box so we know who is on the call. Just name and organization, that would be great. And just to say that the session is recorded, but since these are sites-only sessions, the link will only be shared among the group, and it will be up to yourselves if you want to share the link with the rest of your networks. But if you're happy for me to share with the wider group on our platform, please do let me know in our via email. And just to say, today's session, every site has got 15 minutes to do your presentations. And we've got 4 sites starting between now until break time, which we've got about 5 minutes for a break. So we're hoping for about 5 minutes past 2 to 10 minutes past 2. Then we have the rest of the session presentations, which I think will be about 5 of those later on. Then we have the question and answer section from about 3:25 to 3:30. Hopefully we'll have enough time to go through those. We also have a list. Thank you for submitting your interim reports. And we've done themes in terms of things that are working well, and where there's issues. So hopefully with enough time, we'll be able to discuss those later on. That's it from me. I'll let you crack on. And the first presentation today will be from David and Steve and Ellen, if you can just move to the first slides.
Steve, I'm still struggling. I can't get
Are you
on.
struggling? Okay, yeah. Hold on.
Just 2 seconds.
I will do mine. It's okay. It's all right. Because I've got them here, so it's okay. Do we have David on the line?
Hello, it's Jill Carty from Cheshire and Warrington Carers Trust.
Oh, hi, Jill.
Yeah, hiya. I wasn't given the running order, so I've just been watching the screen and realised I'm first.
All right, you're the first ones to go. Yeah.
Right, so it's the first time I've delivered one of the talks here. So would you like me to just do a little bit of an overview as to what we've done so far?
Yeah, that's fine. That's up to you.
Yeah,
You've got 15 minutes, so I'll be timing you.
Lovely. So just a little bit of an insight into the Cheshire and Warrington area. There's 1 regimental barracks in the area. We've got 1 field hospital, 8 British Legions, 3 breakfast clubs, and 2 NAFI break charity groups. So we've managed to link in with all those organisations. We've had particularly difficult with reaching into the Dale Barracks, which is the Army Regiment, which is closest to us. We had, just before Christmas, we were invited along to a health event where there was, what's happened is the regiment has moved back from Cyprus. So we were invited along just to sort of showcase what we do as an organisation. So it was quite useful to speak to quite a lot of the soldiers that were there. A number of the families had children that had additional needs, so we were able to explain a little bit about the support available. Following on from that, in February, we were invited back to meet on a small sort of one-to-one basis with individual soldiers. So fortunately, there was only 2 soldiers that came along to that event. The regiment is from Yorkshire, so the support that we could offer was quite difficult to give them the support that they needed. One particular soldier, and quite sort of give you a little bit of an insight, he cares for his mum who is a tetraplegic, Now, he's probably, I'd say, in his early 20s. He's going home of a weekend to support his mum in Yorkshire, just outside Leeds. The family lives. We were able to give him some information about the support that was available, but what ultimately he wants to do is to leave the regiment because he is finding it difficult to balance his army career with that of caring for his mum. So we were able to link him into the Leeds Carer Centre because that's where he felt he could get better support because of what's available in the Leeds area. So ultimately his plans are to leave the army. There was another gentleman who is caring for his ex-wife. She's in recovery from cancer and she's got some particular difficulties with her health as a result of the chemotherapy. So he is sort of dipping in and out of caring for the children as well as making sure that she's managing, to care for herself. So they're the sort of the ongoing support that we're delivering in the Dale camp. I went along to a local community charity that's set up to support army veterans. And they said that they've also had difficulties getting into the camp. I don't know what else to try really. I've tried contacting SAFA, who are based at the camp. I know that there's a welfare office. Tried to reach out to them, and there's also families that live on camp. We haven't got permission to put things on notice boards, as you can imagine, because it's a military area, I suppose. So we can only go in on their invitation. So I think that's going to be one of the difficulties that we have is maintaining that, information stream, so that if there is a serving soldier who needs our information, it's making sure that they're aware of our presence. I don't know how to reach out. We've been and visited all the British Legions, fly posted those, made contacts via email. So they're all fully sort of, aware of the support that's available. The only thing that we haven't done so far that's left in terms of making more of a connection is with the breakfast clubs. They tend to take place on a Saturday morning. So they're yet.
Excuse me, Jill. Sorry, Jill. Do you want me to move the slides for you?
Yeah, you can do. Yeah. Yeah, if you move to the colourful one, the next one, that would be brilliant.
This one?
Lovely.
Okay.
Yeah, so in terms of establishing links, we feel like we've sent all the information out to all those existing groups that were in the Cheshire area, and we're just going to continue to keep sort of knocking on those doors and repeating the information that we've sent out. So I think that's it at the moment, really, I think. I know Sigrid had sent me details of the Cheshire Forces champion, so we're going to make contact with them as well. So I think that's me done, I think.
Thank you, Jill. Yeah, we'll come back to touch on some of the issues that you raised within the last interim report towards the end of the session, if
Okay,
that's all right.
Yeah, that's great. Thank you.
Okay. If we can move on, have we got any questions? I don't think we've got, but we'll ask any questions later on. So our next presentation is Courage for Care Veteran Carers, Katie Humphrey. You there, Katie?
Hello.
Hi, you're all right. I see you. Yeah, I see you now. Yeah.
I thought I normally have a thing on, but because I went through the NHS England one, it took my blurry background off. So you've just seen all my hanging out washing behind me. I do apologise. Right. So just to recap, we are presenting this. So that's myself and Jonathan, who'll be chipping in a little bit. We're from the Frimley ICS, and we are Berkshire Healthcare. And our project is about supporting carers and families linked to veterans that are accessing our Op Courage services. So one of the things that we did is last time we had some focus groups, and we connected with our carers, and we got the themes from what they wanted, and we've actually introduced a family liaison and support lead role. So part of our work, the main bits of this project now are embedding that within the team and seeing how we can utilise that role. So next slide, please. What we're trying to do is introduce a pathway. So for friends, family and carers, one of the bits of information is obviously that as we all know, people don't identify as carers. So we're trying to use terminology like friends and family as well. So within that pathway, we want to try and make sure that when people come to the service, that carers are being identified, that we're confirming how they're supporting the veteran, and or if there's any children within the household that are having that caring role, because through some of the feedback, the wider family also performing quite a lot of caring responsibilities. Also within that, then we want to make sure that they're welcome, that there's key contacts for that they can speak to, and that they're supported and get the relevant information, and that they're made aware of any sort of statutory things that are available to them, like carers assessment, because also the feedback was they weren't identifying as carers, so they weren't necessarily going and looking for that information in the first place. So one of the things that we're trying to do is change some of that language and terminology, but not lose the word carer completely, because we know that to access some of these other things, that they still need to understand how they might link in with that. We're also then wanting to involve them, if possible, and obviously with patients' consent, in as partners in delivering that care, and that if they are transitioning through services, that they're seamless. So that's kind of the aim of our pathway, both within Op Courage services and other services as well. Next slide, please. So within Op Courage, with this family and carer support model we've created, so the idea is that all members of staff should actually be helping identify carers and offering that information and advice. So you can see on the left-hand side, that's kind of a universal function of all of the clinical teams. And that in those roles, they should be discussing with carers, suggesting having conversations about whether their carer is helping them identify as such, and then providing any information. And we've come up with some templates to help them do that. And then it kind of, there's like a pyramid of personalising that support, and actually the carer might have increased levels of complexity of needs. So in that third section there, it's carers who might require some support. So the clinicians will be collaborating with our family liaison and support lead role, seeking advice from them about any resources or contacts, and maybe pointing them or connecting them to other organisations. But where there's a real complex needs or family dynamics there, that actually they're making a referral to that family liaison role, and they're working in partnership and connecting to partner agencies. So there's been quite a lot of social care issues coming up as well, and very much a holistic approach being applied with that. Next slide, please. So within that triangle, if the family liaison role is at the top of the triangle, then this is almost like other layers within the top of that triangle. So the family liaison and support lead role also then kind of breaks down the support that she's giving to families into these different steps, and the steps also linked to the kind of provision that the service and the team are giving. So again, there can be sort of routine information signposting through outreach activities or virtual fairs. There might be some additional more collaborative support, one-to-one support, where she's working more in depth with families following that initial assessment. And then there might be a much more multi-agency approach in kind of steps 3, 4 and 5, and sometimes safeguarding issues have come up. One of the things that we're looking to do is get some feedback on that. So we've created a form to do that later on. You'll see that in another part of the slide. So next slide, please. So what we're trying to do is overlay the principles of the whole team engaging with friends, family and carers with the specifics of that family liaison role, so that everybody should have a role in identifying and discussing and helping signpost to some initial carer contacts and information, but that where there's more complex needs, that family liaison role is getting involved and adds it to her caseload and reports back, and that everyone throughout that process should be trying to record and identify any interactions and the support provided on our our patient information system, which is called Rio. Next slide, please. I was going to be really good and have a timer, but I forgot to click the time, so hopefully we're doing all right for time. One of the other things that as a trust we're looking to do is within some other teams is introduce a carer recognition tool where staff will have these cards on a lanyard. It's going to be developed and then it's going to be on there to prompt some discussion. So we saw this idea that some areas in the southwest had done, so we've adapted what they did because it was a brilliant idea, so we can't take the credit for the initial idea, but we had some focus groups to tweak it to our purposes, so we changed some of the terminology and the definitions, and we want to make sure that the clinicians are having that initial conversation with the carer, with the service user, updating information on patient records as appropriate, and then offering that support or information as part of that. So all these are quite new concepts, and what we're going to be doing is running workshops with the teams and sharing that information and hopefully trying to embed it in their everyday practice, because that's really the ultimate goal. Next slide, please. Next slide, Steve, sorry. So also what we've done is we looked at various bits of best practice. So we've picked out as well the quality, the GP quality marker questions as well that others have used in the past, and we've adapted that again for our needs, for our specific service, to try and help the staff think about some of the questions that they might be asking and some of the actions that they could be taking within that. So I won't go through those because you're all probably familiar with some of that. But what we also felt is really important is to build upon what others have done before and not reinvent the wheel. Next slide, please. Next slide. Oh, yeah, perfect. So we're going to evaluate, as I say, how this role is embedding. There is a link there for when you get the slides afterwards. We've got a form that we've created because we really want to understand the impact of the family liaison and support role. So we are targeting the families that have been referred to the role, and we'll be getting that feedback and trying to cluster whether there's any follow-up work that we can do from that, be it extra resources, be it putting on education sessions, be it making further links with other colleagues and partners. So we're going to use that, and hopefully that will inform how the role continues to develop, and we'll take that quality improvement kind of plan, do, study, act approach to make any tweaks and changes to the role that we're embedding. Next slide, please. I'm going to hand over to John now, who is hopefully going to just mention the last few bits, because again, as part of this, we're looking at some case studies to reflect the work we're doing.
Yeah, absolutely. Thanks, Katie. And I apologise for making Katie's voice struggle through the last bit. So it was, I feel particularly mean sitting here going, Katie's voice got to go. Anyway, next slide, please. Okay, some of the most important bits that we're getting as we're going through, and we're sort of going to talk sort of very generic in the case studies, is making sure that we're getting the feedback from the carers, and taking the case studies as we're going through and making sure we're capturing the case studies, is to make sure that because it is a new role, that we're actually able to be as agile as possible in terms of reacting to the carers that we're working with. One of the most important things I think that we're finding is actually trying to make sure that the message that we're putting out on our websites is one that's easily accessible, because I think a lot of carers have said to us, I want to get there quickly, I want to get to the information as quickly as possible in a form that actually makes sense as soon as possible. So what we will be doing, we will be adding in as many of the extra bits as possible as we're going along. One of the things that we are really aware of is that the role that we've now stood up, virtually everybody who comes through our service could do with the input, with her input. So trying to make sure that we're getting the right cases to her, and also making sure that the rest of the team are taking on the information and passing on the information, as opposed to involving her formally, I think is quite important as well. Next slide, please. Okay, the Mind the Gap virtual drop-in sessions is something that we're going to be working on. Next slide, please. We've got one aimed for the, I think it's the 24th of March, Katie.
Yes, you're right. It's on the next slide,
it is.
Yeah.
Oh, it is on the next slide. Sorry, I'm getting ahead of myself. Apologies. What we're trying to do is make sure that we're going to give good value for the carers, because we do appreciate that it might seem like an hour is if anybody should be able to give up an hour. That sounds a bit arrogant, and actually we need to make sure that that's actually as responsive to the individuals coming in. We are aiming to look for it being on a monthly basis, an hour sessions. We are trying to avoid the idea of having any kind of appointment required, and being as flexible as possible. And being online, it does mean that people can join and they haven't got the travel problems of getting around. We're looking at how we can advise in terms of one-to-one, which is likely to have to take place outside of the actual drop-in groups, which is going to be absolutely key to it. But I think the opportunity for the group session is going to be quite a key one, because the carers can actually sort of share experiences and actually sort of take some advice and some information from each other, because I think that's going to be as important as possible. Next slide, please. As it says there, first session is going to take place on the 24th of March. Bearing in mind that we're pretty short on time, this is the data that we're going to be looking at trying to capture as we're going along. We're very well aware that the first session that we run is likely to be is going to be sort of a sounding out session as much as anything else, and we will take what works from that and implement it in future ones, and try not to stick to any hard and fast framework with it, so we're responsive to the need of the carers. Next slide, please. And I think, I have no idea, because like Katie, I forgot to hit my timer as well. But Steve, unless anybody's got any questions, that is a whistle-stop tour of what we've been up to and where we are.
Oh, thank you, Jonathan and Katie. I think in terms of time, you're doing all right. Lots of time to spare.
Oh, there you go.
Questions.
Never been known to not talk for more than I'm allowed, so I'm really impressed with myself.
That's actually going to help us to catch.
That's all right.
So thank
I'll
you very
take that
much.
then.
Yeah,
I'll take
really
that.
good. Again, if you've got any questions for Kate and Jonathan, please do put them in the chat box, and we can pick them up for later on. And please, Kate and Jonathan, if you've got time as well, please look in the chat box for any of the questions that might come directly to you. We shall move on to the next presentation, which is from Chris in Dorset. Chris, are you there? Oh, yeah, there you are. You've flashed up on the screen. You're on mute, Chris.
Good afternoon, everyone. Yeah, and I was going to be joined by Di, who's an ex-carer and also ex-armed forces. But unfortunately, Di's got a new telephone and she can't get up the link on her new telephone. So you've just got me. So and I work for a charity called Prama, and we're delivering our project with some principal partners, the Veterans Hub, which is down in White Regis, and as the name suggests, it's been set up by veterans for veterans, and the Defence Medical Welfare Service, which is a charity which supports armed forces people, both whilst they're serving and after their service. And also we're working with the NHS Dorset, the local ICS as well. Next slide, please. On top of those principal partners, just like Jill and Katie and Jonathan were saying, we're now working with a much wider network of partners. And so that includes other charities, other statutory agencies, and also particularly military charities and military community groups, veterans community groups. I think it's been one of the real joys of this project to find out what an extensive network there is, in which we can sort of like promote the need for carers awareness and support. Our project is hopefully quite straightforward. We're trying to do our best to learn about the needs and aspirations of local carers from the armed forces community. We're supporting individual carers and groups of carers, and I'll talk about that a bit more later. So at the moment, we've got about 20 plus carers we need to chase up who've contacted us through surveys we've done. And also, we're really keen about influencing ourselves, obviously, but also partner agencies, so we can deliver a much more effective, to deliver much more effective support for carers from the armed forces community. And all of this does involve either carers themselves or ex-carers or members of the armed forces community helping us. Next slide, please. One of the things Steve put in his email to us is, could we just describe the community of people we're working with? So there's about 58,000 armed forces veterans and their family here in Dorset. That's partly because there's some quite substantial army bases here, and the Navy used to have quite a big presence down at Portland. And as a result, we've also got serving personnel. And I would categorize our community, like I put down in those points there. We principally are working with the veterans. So we're working with either their families or the veterans themselves. So these are people who have left the armed forces and their families, you know, are no longer involved in the armed forces. But within that, there are other sort of like categories, if that's the right word to use. And I just wanted to highlight the 1/3 from down, carers and employment and or bringing up a family. I've spoken about this point before. One of the key things we've learned is that carers from the armed forces community tend to start caring earlier in their lives than the general population of carers. And it's something which we and our partners have to be really, really alert to, because it means that not only have they got caring responsibilities, but they're probably also bringing up a family. They're also probably having to hold down a job. And so as a result, their caring experiences can be significantly challenging. As Jonathan, Jill and Katie have highlighted, there are also young carers, and we think there's probably a lot more young carers than we even estimate. Talking to welfare units at the army camps, they're certainly aware of quite a number of young carers. But I think, as like Jill was outlining at the start, that there are challenges working with service personnel. We are working with some service personnel, but there's specific barriers there. I just want to also highlight that our armed forces, of course, they have people from many different ethnic origins in there. They've got LGBT plus people serving in the armed forces. But a specific thing about our community down here in Dorset is we do have units who've been where the serving personnel have been recruited overseas. So we've got quite a significant Gurkha community now. So those are soldiers who were recruited in Nepal. And also we've got Fijian families. So people who have come from Fiji, served in our armed forces, and like the Gurkhas, some of them are putting down roots in this country and intending to stay. And it's really important as a future action for us to better understand how those communities are being supported. Because, for example, we're told at the moment that they have their own support networks, which is really, really good. And obviously we want to encourage that. But we're aware from working with other ethnic minority groups that means that sometimes they're overlooked for the mainstream support and it's not responsive to their needs. Next slide, please.
Yes, Chris, just before I move on to the next slide, I think Diane has just joined us now.
Oh, brilliant.
Di, there? Yeah, there she is. Yeah, she's here.
Crikey, Di, you got your phone working.
So just let me know anytime you want Di to come on and I can unmute.
Okay. Yeah.
All right.
Thank you. And we're really keen to look at more preventative work as well. So obviously we're doing, you know, immediate work at the moment, and Di's going to outline some of the stuff she's involved in with some of the other carers. But as I mentioned earlier, we know that people from the armed forces community are caring much earlier on in their lives. And so we want to do a lot more about how we can get on side with those carers much earlier. And I think it was really interesting listening from Katie and Jonathan about just getting everybody to be asking people, number one, whether they're carers, but also whether they come from an armed forces background. And so we've become very good as a system about asking people about, for example, gender, whether they come from a BEMA community, etc., etc. I would hope all partners now are saying, oh, by the way, do you come from an armed forces community as well? Because additional support can be provided, and also it's a better understanding of the experiences they're going through. And I've got a question specifically for Kate and Jill and Jonathan. We know through the Royal British Legion that in Canada, when people have been leaving their armed forces, not only the person who's leaving is assessed, but their closest family member. And what the Canadian military have found out is that 1 in 5 of the people leaving their armed forces has already been cared for. And we think it's a similar number in the UK. And we were wondering whether, as part of, concluding this project, and I'm not saying necessarily have any impact at all, but we write the MOD and urge them to look at a similar model to the Canadian one, because even if additional support cannot be provided at that point, at least they can be connected up with other local care support agencies, etc. And it's that awareness at the time when people are coming out, which could make a real difference. And I'll just give you one example. Di and I went to talk to one of the military units based down here, and they told us that when people join their unit, not only the serving personnel are given a briefing, but their family are given a briefing about how service in that particular unit can impact on their relationships. When they go on deployment, they're given another briefing when they get back, both the serving personnel and the family member. So invariably it's a wife. So when they come back from deployment in this unit, they're sat down and told, look, your husband or your boyfriend is now back. Their experiences could actually affect your relationship. So, please be aware of that. And if you need any support, please ask for it. However, when they actually leave the unit, so when they come to the end of the career within that unit, it's only the serving person who's spoken to and who's given an assessment. And we just said to them, please, 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 that's a real opportunity to support the family, because potentially they might be caring at that point. And interestingly, one of the colleagues there in that specific welfare unit for that unit actually said, yes, my husband's just about to leave this unit, and I'd really like to know what briefing he gets, when he's coming out, because that could really affect our plans. And so to be aware of what support is on offer would be really, really important to me. So colleagues, if you'd like to do something like that, with us to write to the government to say, look, we think that, the closest family member should be assessed at that point of departure from the armed forces, please say. Just one last point, because I haven't had a chance to catch up with Di, and Di's going to conclude our presentation, but we are developing carers groups down here. And I was talking to a colleague from one of the mental health support Ops Courage groups yesterday, and we were talking about the need to develop a program for carers of people with PTSD, where we actually give them a briefing about PTSD, some background and the support which is available. So this is to the carers themselves, not to the person with PTSD. Because one of the things which has been highlighted through this project is that a lot of the carers of people with PTSD are becoming quite ill themselves through their caring role, and that again they're just simply not aware of what's going on. So we were talking about developing a specific program for those carers. So watch your space. Di, over to you.
Hi, my name's Di, and I'm
Oh, sorry,
armed
Di.
forces-
Next slide, please, Steve. Go for it, Di.
Hi, my name's Di, and I'm an armed forces veteran of 14 years. I moved to Poole 3 years ago, and was very surprised that there was nothing for veterans. So I set up a armed forces breakfast club, and we've gone from strength to strength. And I met a guy in Poole that had an RCT t-shirt on. As I began talking to him, once he found out I was a veteran, he said to me, "I'm very lonely since my wife died. I don't know what to do with myself." Well, this Christmas, he gave me a Christmas present. And when I said, "Oh, you shouldn't have done that," he said, "Why not? You changed my life." So I met Chris because he popped into our breakfast club, and he wants to do something for veterans carers, because if you know the armed forces, you will know we are very unique. We are like a closed club. We've got a strange sense of humour. I mean, we don't do non-military people very well. A lot of non-military people think armed forces veterans are all men. Well, I'm not. And so the new veterans carers, because I was at one point a carer and now I'm cared for, and that took a long time to get used to. But our new club will be for the carers, because I know myself that sometimes the carers are kind of forgotten about. They do such an important job, but no one talks about them. The question will always be, how is Pete? How is John? No one would go, how are you? How are you coping? So that's what we aim to do with our carers group. Since I've got involved with Chris and Primer, they have been fantastic. It's gave me a new lease of life. And my outlook on life is, if I can help one person, then that's job done. But can I put in a request that if you know carers, please, if the person they care for dies, can you sort of follow up on them? Because sometimes they are completely lost, because they've spent a long time looking after that person. They die, and what do they do next? And I think that's a very important question. Thank you.
You're on mute, Chris.
Di, do you want to just briefly tell them about the carers groups?
Yeah, we will begin the one in Poole in April. It's for people that care for veterans, and sometimes a lot of the carers don't think they are carers. I quite often get, "Well, he's my husband, she's my wife," and I used to say, "She's my daughter." So we are going to the first meeting. We will ask the carers what they want, because sometimes they just want to sit and chat and just forget home life for a little while. Or we will get some guest speakers in and make sure they are claiming everything they can, because being a carer is sometimes very expensive. I mean, they might have to give the job up. We will move location. And please excuse the noise if you can hear the noise. I live in a building site at the moment, and they've been very quiet, but they've just started back. So yeah, anything else, Chris, that I've forgotten to mention?
No, that's brilliant. And just briefly, everybody, the funding for the carers groups we will be developing here in the conurbation of Bournemouth, Christchurch and Poole, and the one based on the research, a surveying we've done through this Mind the Gap project. So it's already having a longer term impact, hopefully. Thank you.
Oh, thank you, Chris and Di, and thank you, Di, for joining us. It's really important to hear, experiences of people with lived experience. It's really important, and to learn how the impact is having, the positive impact it's having on you since joining the Prama group led by Chris. So, no, thank you for coming. Really appreciated. Chris, I don't know if you've been looking at the chat box. There's been a few mentions for you in there. I think one is from Debbie regarding the young carers. So Debbie says, we found out at Pirbright that many young adult carers were joining the army to escape their caring roles. And there's also a mention by Verity to say that we're going to have a look within NHS, within the organisation, to see if there's anyone within the organisation we can link all the armed forces sites to within organisation. So if we find anything, we will let you know.
Can I just say, and I apologise, colleagues, if this is holding things up, and we haven't researched this yet, but one of the many interesting things we've discovered is that quite a number of carers or the veterans, et cetera, have come from broken families themselves. So it's really interesting, that comment about the Pirbright and the young carers, because, for example, with the PTSD angle, if someone's had a difficult and potentially traumatized childhood, they can be sort of like sometimes re-traumatized in the military, and then that sort of like doubles the challenge for the carer and for the people who's supporting them, because you're perhaps untangling various traumas, various issues in somebody's life, not just that the apparently immediate one from the military. And so we would like to look at it a bit with our colleagues. Sorry, I see somebody's hands up.
Yeah, I've got Debbie. Debbie, you've got your hand up.
Yeah, thanks, Stephen, and thanks, Chris. Really powerful presentation, and as someone who's worked in this space over a number of years now, I really recognise all the challenges and the barriers. So my comment about the Pirbright one was what we did is working through the Pirbright Medical Centre as part of the onboarding assessment, health assessment they had to do there, is we put in a carer question. What we found, and there were there were noticeable attrition rates of those who had caring responsibilities dropping out of the program, the training program, because of caring responsibilities back home. And I think what we discovered was that in many cases the caring scenario back home was exactly as you described it, and was actually really, really fragile. And escape to the army was certainly a big motivator to the young adult carer, and I'm particularly thinking of one that came in from Wales. But in that particular case, what we did through our carer support programme in Surrey was we worked with the army cadet, and we worked with the family. But what they hadn't realised was that with the cadet moving away, with the young adult care moving away, that they were entitled to sort of a reassessment of the needs for the cared for person, and that as a result of this process was scaled up. So I think what I'm saying here is that there is something here about prevention, Chris, and colleagues, that if we can raise awareness around this, rather than wait until the caring situation becomes so fragile that it just collapses. And if we can support young adult carers into career pathways, but support them through enhancing packages of care to the people they care for, that's got to be a real plus, hasn't it?
Definitely, and anything to enable them to develop their own lives and careers, as you suggest, Debbie. Yeah, without having to feel that they either have to remain at home or find an escape route, which may not be appropriate at that point.
Thanks, Chris.
Thanks, Debbie. You've eaten into our time now. All right, we'll move on to the next slide. Please continue to put any questions or any feedbacks that you might have in the chat box, and we can pick that as we go or later on. And our next presentation is from Hazel and Susan. Can I see Hazel and Susan? Yeah, there you are. You're at the bottom of the screen. There you go. If I can are you able to unmute yourselves?
Sorry, I was on mute. I was just going to say that didn't look like our presentation, but it's just jumped into all its colour. So I'm rest assured now. Yeah. So yes, I'm Sue Gill and Hazel, and I'm from First Contact Clinical, and Hazel, who's from the Joint Commission unit in South Tyneside, is also on the call. So next slide, please. So we were actually funded for phase 1, where we were hoping to undertake a peer-based research project with carers. We weren't able to run the peer-based research programme, but we were able to speak to focus groups and individuals and really understand some of their challenges and some of their recommendations. And what came out loudly to us, which we wanted to take into phase 2, was the aspect of learning and education, and really making professionals and volunteers aware in the system that carers are unlikely to seek support. So that's where we wanted to focus for phase 2. Next slide, please. So our plans for this year were to develop a toolkit for all professionals across South Tyneside. Our phase 1 was focusing on not only hidden carers, but those carers of people who have abused substances. So we wanted to continue that for phase 2, but very much what we're developing can be then expanded, and the content can be tailored for all the different hidden carer groups across South Tyneside. Because we want to really increase the capability, opportunity and motivation of professionals to identify carers and then to be able to support them. So we are putting together that toolkit. Will include a range of training and resources that will support them to identify, but then also provide that support, connect them to organisations like some of them that we've heard earlier on. The underpinning values are that we bring the carers' recommendations into the toolkit, and we bring their stories into the toolkit. So we're continually working collaboratively with them and co-producing the resources and the training with them. And what's been really beneficial for us is that the council have launched their care strategy, and we're very much embedded within that. And some of what we've already heard in some of the presentations are starting to really have that baseline data, and then build in the ability to record the identification of carers. And I'm just thinking about our other work. We deliver social prescribing across South Tyneside, and we've had 3,700 people introduced to us over the last 12 months. And obviously, because we're very fortunate to be able to have much longer conversations and more intensive interventions with people. They share things with us that they wouldn't share with the GP, they wouldn't share with the nurse. And so we're able to, we've got a template on the GP system, and it has specific information linked to whether they're cared for and who by, etc., and whether they're caring. And we're able to really draw out and get people to recognise the caring role that they play, that they don't always recognise, but make it known to the medical and the clinicians with who are working with them as well. So that's very fortunate. I know Hazel and her team have made sure that there's a continuous awareness raising under the carer strategy. So very regularly there's different topic areas around carers that all of the agencies across the system in South Tyneside can come together and actually support each other to raise the awareness, draw on each other's strengths, and action plan moving forward, which has been very beneficial on the back of phase 1. Next slide, please. So there's as well as developing the toolkit, we're also supporting to our partners, because there's already really great carer training exists in South Tyneside. So we're not looking to compete, we're not looking to replace, duplicate, etc. But we're supporting them with some of what our strengths are, and that's behaviour change. Because what we know is you can do any amount of training to somebody, but if as a professional they go back into a culture, into a system that they cannot influence, you're not going to get the new skills really coming to light. So it's really making sure that we're working not only with the leaders of the system, but getting people to understand it's not just about capability, it's that opportunity to put that in place, and then really that motivation and growing that motivation based on the results that you're getting when you're working with carers and the support you're given. So we're supporting them to evaluate their training and think about the impact. So as I said earlier, we are focusing on those of substance misuse, but we know we can very quickly adopt the programme, the training, the toolkit, etc., to look at other carers, young carers, veterans, gypsy and travellers, all the different carer groups. We can very much tailor it to support a much wider range of the population in South Tyneside. And as already mentioned, we're really making sure that the carers' voices throughout that, whether that be them co-facilitating, whether that be a train the trainer, and they're actually delivering the training themselves, or whether we've got videos and case studies included in the training. Next slide, please. So what we've done so far, I'm going to flick over some of this because I don't want to repeat from last time. We've re-engaged with key stakeholders, we've got expressions of interest to be involved, and then we started to draft that toolkit. And as I say, we've got some great partners in South Tyneside working with us on this, so we're very, very lucky. Next slide, please. So what's been new since the last presentation? Sorry, I've got a bit of a cold, so my throat's a bit croaky. So we've been collaborating with some of the local carer training providers, as I said. The local hospital have carer awareness as part of their induction, and they want to make more of that. So we're working with them to do that. And we're working with one of the young carer organisations who are delivering training into schools. We've been spending time to really understand the challenges and the barriers of staff within the social care team, and you've got different spectrums. Some of those which feel that they're so busy doing their job, they've been very honest, we don't even think to ask the question about the carer, even if they're in the room and the support they need. Sometimes that is challenging itself because they're probably not going to be that honest with you, with the person they're caring for in the room, right through to actually, I do identify them, but they don't identify themselves. So how do I have a conversation that actually I can support them to recognise they are caring? We've been working with the local therapy team as well to start to look to see actually how can they build that recognition into their pathways. And we've also been working with some of the voluntary organisations across the borough. We're also working with the emergency department at hospital, and we've been looking at, through the anticipatory care project, been really looking at those people who are frail that come into the A&E and taking that opportunity to really understand and ask questions around people that are caring for them and looking at their well-being needs as well. So where that led us, those conversations led us to realise it was more than just the training session, that actually we need some tools to take into team meetings to really increase the motivation, increase the importance of teams to want to engage in the training, wanted to be curious, wanted to, because everybody, you know, people in these roles come into them to make a difference to people. So we can really harness that and support them to make a difference to carers too. We know that we've got a wider reach through being able to develop a train the trainer framework, and all the people that we spoke to so far have already spoken of champions within their teams who would be great to take that role forward. And what that allows is it's not just an event, it's a process. So it's not just the event of a one-off training session. You've actually got champions who can keep bringing it back to team meetings, keep raising awareness, keep reflecting on some of the cases that they've had successes with, and some of the things they're still struggling with, and continuing to provide them with some of that promotional material. Next slide, please. So we've got a couple of sessions planned in March to now test the training that we've been focusing on developing, and I've just given a bit of a draft of the learning outcomes there. What people have said is important is to understand more around their role and the difference they can make to carers. They really want to understand, how would we identify carers? What kind of things might be signals if the person isn't sharing that themselves? So we can really draw on some of the carer stories, bringing in like some of the kinship carer stories, things like that. They really want to do skills practice around having that conversation. What language do you use? Because as has already been mentioned previously, asking somebody are you a carer isn't the best question to ask. So we'll do that through role play and continue to practice that through the session, understanding the caring role that impacts on the person, and agreeing with what Di said there about actually aftercare and the impact it has. And some of the people who are caring with people with substance misuses, their lives change really quickly and become very complex and very difficult. So bringing those stories to life within the training, and then really supporting them to understand, okay, so I've identified what next, because it's not necessarily within their boundaries, within their role to give that support. So letting them know what exists locally and nationally that they connect people into, but then also understanding the barriers of people asking for support, and sometimes being able to do some of that supportive signposting, actively connecting them into some of those organisations themselves, making sure they're aware of best practice. And then Hazel and I spent some time around the what next. So as part of the carer strategy, really making sure that people commit to a pledge, so that they're really demonstrating that buy-in, demonstrating that accountability of going to be making a difference, taking their new skills back into their team, back into their roles, and then committing to share those stories of difference. So really bringing to life the impact that we can have across the system if we work to identify and to support carers very differently. And then the star there is around hidden carers, because, well, we're starting here. What the council has also done is embedded carer training within their whole workforce training programme. So that allows us to start to build on this and to make it available to everybody across South Tyneside. So short and sweet, Stephen. Catch up on your time.
Wow. Thanks, Sue. Plenty of time left. We've got 3 minutes. Thank you for the presentation. I was just going to mention, you mentioned resources. Please do share them with us if you want us to cascade and share nationwide, because we've got our collaboration platform on NHS Futures. So please do send them and we'll be able to share those. Questions
will, and I
questions
think,
for Susan and Hazel, please put them in the chat box, or you can hold on to them until we have the question and answer section later. If we can take our 5-minute break now, if that's okay for people. Have your cup of teas, coffees, biscuits, what's or not, and if you can come back at 10 minutes past, please.
Helen, do you want to see if you can do the slides now?
Yeah, I've stopped sharing, Alan.
Can you see that? Yes. Yep.
Yeah.
So we've got Amelia next, and then we're just gonna, because the break was gonna be after Amelia, was it?
Yeah,
But-
yeah, that's fine.
Yeah, okay. I just want to check that you can hear the recording.
So it's
Is it just the one recording
it's just the one. If you go
here?
keep going. Yeah, that one. So
Right, see
yeah,
if you can hear this.
yeah,
It was simply brilliant to get such a broad spectrum. It was simply brilliant.
You can hear it?
yeah,
Great. So I'll just go back now then,
yeah.
wherever I was. Amelia.
Awesome.
Yep. Great. I seem to be sorted now that Verity sent me, just took about 10 minutes for the email to come.
Yeah, probably because of this, because of the film, because there was not other film apart
yeah,
from that one. I
maybe.
had to put that film in. Yeah,
Yeah. And then SharePoint was just going.
was he not accepting it?
Anyway, we're sorted. I'm on.
We're sorted.
Yeah.
Right, I'm going to make a cup of tea quickly. I'll see you in a minute.
Yeah.
Smile, Helen. Sun is shining.
Mister, rubbing your hand cream in.
Oh yeah, my hands are dry, aren't they? I had to reach
I've
for
got
my
my
hand
lip
for it.
stuff. It's my lips that are really dry.
It's good for you. You need to dry. You need to make sure your hands are well moisturized.
Moisturized.
Yeah.
So you can see my screen okay now? Yeah.
I can see your screen fine now. That's
Great.
perfect.
Great stuff.
Are we all back? It's 2:10 now. Oh, there we go. A few faces coming back. Yeah. Thumbs up from people. Yeah, that's good. That's good. Amelia, are you online? I think she might be making one of those fancy coffees. I'm sure I'd seen it pop up earlier.
Yeah, I think I did too, Steve. I wonder if it's worth going to the next person and then I can send her a quick email if that's helpful.
Okay. Amelia, if you're not online, because I can't see you, we're going to go ahead to the next person, if that's okay. Helen, are you happy to move on to the next slide, please? Michelle, got Michelle and Sam. I can see Michelle.
Yeah.
And
Thanks,
Sam.
Steve.
Yeah, there we go.
Yeah.
All yours.
Okay. Thank you. Who's doing the slides? Is it you, Steve, or?
So I've got my colleague Helen moving the slides.
Ah, okay. Thanks, Helen.
She likes to be called Steve anyway, so that's all right.
Okay, I'm going to start off. Helen, would you put the I think the second slide on, the next one, please, if that's all right, and perhaps the one after that as well. Okay, so thanks everyone. Just as a reminder, York Carers Centre this year, or last year, with the scoping phase, was focusing on families and individuals caring for someone with alcohol and or drug dependency. And we focused on the City of York, so it's place-based work. And throughout the project, we've been thinking about existing local assets and looking for solutions in York, knowing that we can share the learning wider across the ICS and with networks across York, and also the wider network of Carers Trust. And we had the opportunity to do that actually just before Christmas this year. So just to recap on plans for the embedding work, we continue to work with carers with substance misuse and alcohol, but we also added in carers of people with gambling addiction, just to widen the work and to expand it a little bit. So at the beginning of the embedding phase, we chose elements. So in the scoping phase, the carers that were part of a steering group wrote a report, and they highlighted some key areas for development that they wanted to work on and that they wanted York Carers to work on. And so the plan was to re-establish the steering group with some new people if possible,
continue to provide monthly support, and Sam's going to talk about that in a little while. They were really keen. One of the really key areas, and it's been mentioned already, is about information and training, and they were quite specific about what they wanted in that. Initiating communications, that's sort of communications right across between agencies, and also just widely across York, and very successful in doing that. Sam's going to talk about the marketplace event and partnerships, and then to report the findings and the recommendations and present those to carers and to service providers. So Helen, could you just put the next slide on, please? So at the heart of this embedding phase was the steering group, most of whom were involved in the scoping phase. They're all really strong advocates for this group of carers, and also really passionate about improving services for carers in York. The peer support and steering groups now always include a speaker that has been identified by the group themselves. So there's been a huge range of speakers and many more planned. So some examples of that are where they've brought people in from partner agencies such as Narcotics Anonymous. So they brought people that had used the services themselves. So I've got some quotes here from John, who was addicted to crystal methamphetamines, and Steve, who spoke about his addiction to alcohol. And it was great because carers could ask them direct questions, such as at what point they realised they needed help, and they asked them how their addiction had impacted their family and friends and work, and one of the questions was, how did they make amends? So so those sorts of conversations are really helpful for carers in thinking about what, I suppose, in normalising their needs and their requirements as well. So regarding training, Sam managed to get hold of a social worker from America who is attending York University for 3 months on a Fulbright scholarship, and Sam may tell us a little bit about that in a minute. And a project that Sam's been involved with called Stitch Away the Stigma, which we spoke about last year, part of the scoping project. Somebody called Colleen Lally from Recovery Wellness, and they are offering 2 monthly online support groups for people affected by addiction now, so that people all over the place can access those groups. And Colleen herself travelled from London and facilitated a creative mindfulness and breathing session. They've also had counsellors speaking about anxiety and depression, and planned for the future as a GP and also a liver specialist that's booked to come in over the next few months. Sam, I don't know if you want to add to any of that before you go on to your slides at all.
I guess it's, as you say, Michelle, it's highlighting the importance of, having the steering group. And now we've really put that out there, and carers are really keen to get their voices heard. It's been really empowering for them to take some lead in developing the service. And all that is, thanks really to having this extra pot of money and being able to sit back and look at this service and extend it, really. And now carers are at a point where, they're regularly coming back with ideas and wanting to run with things and get involved themselves. Yes, they've really enjoyed having the regular monthly support groups, the option of hearing from someone, either, a professional from another organisation such as AA or NA, or someone in recovery coming along and sharing their story, as Michelle said. And then other, aspects of the monthly support group that they've been engaging in has been that peer support element. And, that's paramount really for anybody to be able to, first of all, manage to get to a group. And quite often carers will say, it's taken me such a long time to, first of all, to find you. I didn't know I was a carer. And now that I'm here, I wish I'd done it sooner. And then on top of that, as Michelle was saying about, the training. So we've had such as Colleen from Recovery Wellness come and do a nice creative session. And, we've linked in with the social worker in America at the same time, which was really valuable for her and for us to hear from her. But we've had other speakers come along over this period of time, whether they were from GAM Care or NA or wherever. And the carers really, report back that it's really important to hear from different people and get different perspectives, because it gives them hope at the end of the day, hope that things might change, in a positive way. In relation to the training, from another angle, and touching on what South Tyneside was saying, we have some care awareness training that we offer to professionals as part of the Carer Centre. And because it's myself that leads on that, substance misuse carers are always included in that. So we're always talking about, we'll talk about generically about carers, but we also include anyone affected by addiction. And that's a fabulous opportunity to raise awareness with the professionals across the city, so that they're aware, that we're not just talking about general conditions, regular mainstream conditions, if you like, but the hidden carers, the mental health carers and the substance misuse carers and the carers affected by gambling. And coming up in the next few months, we're working closely with Caring for Carers, which is a local part, like a local section of the local hospital that's now put together some work around supporting carers in the NHS in York. And so we'll be doing a presentation and helping them run a marketplace event so that they can get other organisations there, some of which may be substance misuse as well as other cared for conditions, if you like. So it's been a really great opportunity to build relationships. And with healthcare in particular, public health in York have been fantastic, and we've managed to really, springboard into other organisations that we didn't know were there, that have maybe popped up over the years that, we've not been and had the opportunity to make those connections. Next slide, please, Steve. Oh, sorry. Steve as such. So one of the things that we, when we were listening to carers, one of the things that we took on board was their request really for an opportunity to be able to get together with different organisations all in one go. So there is value in having a guest speaker come along to a session, but there's also value in being able to come together face to face, in person, to an event, especially after the past few years when there's been very little, personable contact. But to get together in an environment where they could meet and go around at their own pace, different professionals from different organisations, different people in recovery, and talk in a relaxed setting. And so we organised an event that took place just before Christmas in December, and it was well attended. We had some carers that had never been before, that had never come along, which was really, hats off to them for being able to do this, and some carers that were known to us. And through organising the event and ensuring that as soon as somebody arrived at the door, that they would be greeted, they would be taken through and around the marketplace, that they wouldn't be left on their own at all. That really worked, especially for those carers that maybe hadn't been hadn't been ever in contact with anyone else to access support, as well as those that maybe hadn't been for a while and were a little bit anxious. So we wanted to put carers at ease from the minute they arrived. So we had around 8 volunteers that were either managing the door or in the kitchen or milling around and introducing people to each other, and also ensuring that all the professionals and organisations were looked after. And the different types of organisations that were represented, there was 14 in total. And so there were people from Narcotics Anonymous and Smart Recovery, from Al-Anon, from AA, from the local drug treatment service, from public health, GAM Care and Northern Gambling Association. So representatives from all of those substance misuse type services, as well as the local treatment service and local rehab. And it was also a great opportunity for the professionals to catch up with each other, because that doesn't happen very often either. And some of the feedback that we got from volunteers and from other professionals was that this was a great, event that doesn't happen very often. We need to do more of it. So, one of our things when we're thinking about moving forward would be to host events like this more often. There's one thing that crosses my mind, is that if a carer woke up that day thinking, I know that there's this event on, and I'd really like to go, but then they're just too scared and they think, oh, I'll go next time. but there isn't a next time. We haven't got a next time, you know, without funding. So, you know, going forward, it's something we want to do. So we're hoping to try and, you know, find further funding to embed this a bit more, even if it's on a lower scale. Yeah, and next slide, please. So around the marketplace event, there was a lot of media, which was fantastic. So we did a press release, and I don't know, everyone ran with it. And the next thing we did, a little spot on Radio York and Greatest Hits Yorkshire. One of my colleagues within the team came down and did a little Instagram film. And then we also did a couple of interviews with York, that's TV York. There's a local TV station. And so we did some before the event, and then we did some after the event. And I wonder if we can share. I know, Steve, you were helping me with this earlier. I'm wondering if we could share a clip, really, I guess, of Mark from this guy. Is called Mark Green. He's he is in recovery, and he was at the event, and we've built a really good relationship since the event, and he just wants to say a few words about the event.
It was simply brilliant to get such a broad spectrum of groups all under one roof at the same time and the same day is just, well, simply brilliant, and hats off to York Carers for doing it. It's about information, it's about sharing information, it's about breaking down barriers. I will use the word stigma because it's such a relevant issue, not just for substance recovery, mental health recovery. As Sam said, there was representatives there from groups offering help and support for people struggling with gambling addiction. It was just simply brilliant, and truly, I've already spoke with Sam privately. I hope this event can run again because it needs to. It's about information sharing, communication, and it was so well organised. From the minute we were one of the first groups to arrive, and everything was just like a Swiss watch. Congratulations to York Carers. It needs to come out of the darkness and into the light, and then more people can get well, more families can get well, more people can recover. Yeah.
Thanks. I mean, you know, Mark himself had admitted that he's in recovery, and he's very much the key person to contact in York in recovery now. And because of this event, we have built further relationships. We have got meetings planned. They are, you know, putting together York in recovery and inviting other agencies together to do like a recovery barbecue for people in recovery and for family members to come along around the King's coronation weekend. So, and going forward, you know, Mark's a great advocate along with some of the other professionals as well, AA in particular and NA, for us doing this more often and to somehow work together perhaps and try and find some funding so that we can do it on a regular basis if nothing else comes about. Next slide, please. Thank you.
It was simply brilliant.
It was, thank you, Mark. So yeah, and there's just his key message really. It's got to be held again on an ongoing basis. And as I just sort of said, you know, if somebody wakes up and they're too scared to come that day, then what? Yes, they can contact us, but when will they get an opportunity like this to meet a lot of different organisations all at once? Next slide, please. So another key aspect that came out of the steering group was raising awareness. And at first, we were a little unsure how we were going to do this. We were looking at different ideas, and some of the carers were really keen on the idea of putting their stories together and helping us put a book together. And we decided that that was going to be a longer term project. And in the short term, it would be great to get something out there to raise awareness. So carers came together, put some words together. We, you know, worked with our communications team and put a flyer together. And the carers themselves decided that they wanted to distribute this. So working with a team of volunteers, we got a list of all the different organisations that we could distribute the flyer to. At the marketplace event, one of our carers came along that we hadn't seen for a while, and wondered if we could add a QR code. Now, this is something that I hadn't, thought of. I'm a different generation. QR codes are only just entering my world. And we decided, yeah, brilliant idea. And I think, there was different QR codes we could have. We could have a QR code around language barriers, like perhaps you click on the QR code and you're going to get it translated into Polish or, but in reality, we couldn't do that because the whole thing would be covered in QR codes. So we decided to just put one on, and then people could access our website, and then they could then translate it themselves, because we do have a large population of Polish people in York, and other people from other places too, but we've had contact with a few Polish representatives, and we wanted to support them, but we then was just thinking, we can't just do that, because we might miss a language and that would be difficult. So anyway, but we have now got reprinted posters, flyers put together. And when some of the carers were going out to GP practices, on spec delivering flyers, they were told by some practices locally that they couldn't leave flyers there, and that there had to be another way of doing it. So we came up with the idea of a poster. So subsequently, again, thanks to Mind the Gap, we wouldn't have had the money otherwise. We managed to get a poster developed, and then, a QR code put on that. And that's in the process of being distributed throughout York. And the idea being that, hopefully people will become more aware of us. We will become more visible, and rather than carers wondering for years on end, where can I get support from, they'll be able to find us. And I think the fact that the title is "It Could Happen to You," there was a lot of discussion around that. Carers decided they didn't want it to say, "Are you affected by addiction or gambling?" They didn't want to have that stigma, if you like, put out there straight away. They wanted anybody to pick it up, so anybody could just see this pink and green, lit flyer, pick it up and say it could happen to you. And that could really be what could happen to you, and encourage people to read on, so that was the idea behind that. Yeah. Thank you. Next slide, please. Over to you, Michelle.
Thanks, Sam. So you can all hear Sam's passion there, and she's definitely driving this project forward, along with the carers that she's working with. So just to say that in December we had a real opportunity to go to the Commitment to Carers conference, thanks to Jen and to Steve and everybody. And that was a really great opportunity to share the learning with a wider national audience, and also to learn ourselves. And then we were invited to, I think it was Campbell that invited us to go to the ADAS meeting, and it was the carers leads, and then again able to share the sort of the results of all the work that's been taking place with the carers leads in the region. So that was really brilliant. And just to finish off, I guess to say the work on communication has been really rich, and it's brought in good rewards with really much stronger agencies across York and wider. As you can see, the raised media profile for the work and the beginnings of carers' plans to tackle stigma. The steering group's really active. It continues to be active, and to meet the biggest challenges, what's next and how to continue and to keep those people engaged. So we're going to hopefully use this as a basis for continuation funding. Just conscious of time, so I'll just end it there, but thank you very much, everybody.
Thank you.
Oh, thank you both. That was really good. We've got a few questions in the chat box. One basically from Verit. I think I was going to ask the same question as well, regarding Mac's video. Is he happy for us to share the video?
Oh yes, he is.
Yeah?
Yeah, more than happy. Yeah, if you wanted
Okay.
his email address, I'm sure he'd give you that, and his phone number. Yeah.
All right, cool. That's fine. Thank you very much. And the other one as well was from Verity regarding the GP surgeries. It's saying no. How come they said no to, is it the flyers?
Yeah, I don't, it's not a personal thing. It's nothing to do with, it being around substance misuse. I think it's just in York, and I don't know if it's the same everywhere else. A lot of places are going paperless. So, definitely down at the local authority, they don't really appreciate you popping down with a load of flyers, for example. And obviously GP practices must be the same. Maybe not all, but some. and they said that, you know, they had no room for the flyers, so they would prefer a poster or something.
Yeah. Okay. Thank you very much. And I think we've shared a few of your flyers as well in some of the recordings that you've done with York Radio on our platform, and they seem to have gone down really well with people, especially professionals and other carers as well. So please keep them coming if you do those more as well in the future.
Thanks, Steve. I know now that we've got the contacts, you know, then we're not frightened of just giving them a bell and saying, you know, we've got a story.
Yeah.
Let's go with it. Yeah.
Oh, thank you. Really appreciate it. If we can move on, please. Any questions for Sam and Michelle? Just put them in a chat box or hold them until we get to the end of the session. Next, we've got Shanna, the carer support group for 18 plus autistic adults who care. Shanna, are you there? I've seen you. Yeah, there you are.
Hi. So my name is Shanna and I'm the Adult Services Director at Autism Bedfordshire, and I oversee services across Bedfordshire, Luton, Milton Keynes and Hertfordshire. So like Steve rightly pointed out, I work with autistic people and those that are 18 plus. So I'm going to just kind of fill some of you in because not all of you know who we are and what the project is that we're doing, because this is our second year on the project. So in our first project, we held various voice groups with autistic people who are carers, or helped autistic people understand what it meant to be a carer and help them understand if they had carers' responsibilities. So where the adults were telling us that, yes, they were carers, we were supporting them with understanding what support was available to them. We were listening to the issues that they were facing when they were accessing health and social care services. And we worked with them to put resources into place that were made available in easy read formats, because so many things that are created for carers are created for people that aren't neurodiverse, and that was causing real problems for the autistic community. So alongside that, we were hearing their voices about what was happening when they were having needs assessments and support from local authorities, and from health if they were going into hospitals. So I won't go 100% into all of it, otherwise I'll just spend all my time talking about last year's amazing project. But the outcomes of it were, there were quite big issues around people who were doing the carers assessments, not understanding what, one, autism is, two, what the needs are of somebody who is autistic. So they weren't making any reasonable adjustments when those needs assessments were taking place. But also they're just receiving random phone calls for somebody who's autistic. That's really terrifying, not knowing what call's going to happen, when it's going to happen, and what information you're going to be asking for. So that person themselves goes into crisis, and you have the person that's caring who is autistic in crisis, while the person they're caring for is also suffering because their carer is in a state themselves, because people aren't just making reasonable adjustments and understanding the needs of the carer. So that led into our second year, which is what I'm going to tell you about today. So lots of you have been on our webinars, and I really, really appreciate those of you who have come. They have been phenomenal. I'm really excited to actually talk to you about them today, because the response has just been huge. I think I rang Jodie and I was like, Jodie, we have over 100 people signed up. We were expecting about 20. That was the hope, and I'd been delighted with 20 professionals attending this workshop to upskill them and give them the opportunity to learn how to support an autistic carer better. But it just got bigger and bigger, and I want to thank a lot of you because so many of you passed that information on to other professionals. So thank you so much for working with us and making sure it was just getting out there as much as possible. So really sorry, but I really want to say Steve, because I can just see Steve in my screen. Can I have the next slide, please? So sorry. So we ran 3 professional webinars. And these webinars, like I say, were about supporting autistic carers. And I'll break those down for you again in a minute and what those topics were. But I just wanted to highlight and give you kind of a wraparound report of what that looks like. So we had 530 people register for the 3 webinars online. 90% of the attendees were health and social care staff. Now, the 10% of people that weren't health and social care staff were community and voluntary sector staff. So just phenomenal, absolutely seeing the people come through that we wanted to. And of the 530 that registered, 327 professionals attended. Now, that sounds like that's a big drop off, but for those of you who run professional webinars and meetings as I do as part of your job, you no, you only ever get about 50% of people actually attending when they sign up for, because we all have such busy things, and there are things like safeguarding that gets not in the way, but that's a priority and absolutely has to be done. So if I could go to the next slide. So the workshops themselves, the information that we got back, I asked professionals how they felt about them. And for me, it was really important that we made sure they were being pitched at the right level. So if we were ever to move forward with this, we would make sure that the professionals actually enjoyed going. We don't want people just showing up because it's a tick box exercise and they can say, well, actually, I went on this. We wanted to make sure that people were actually enjoying them and getting something out of them. So we asked them to feedback to us on how they felt about the performance given by Autism Bedfordshire in these webinars. So 4.3, I'm very, very happy with 4.3, because you're going to have a lot of people in there who do know what they're talking about. And there's always room for improvement. There's always more things that we can do. And I'm really open to that as an individual. So we could move on to the next slide. Lovely. So some of the outcomes, just to give you guys a highlight of what came off the back of the webinar. So 3 local authorities have updated their carers assessments to be autism friendly. That doesn't sound like a lot, but for us, that's huge. We actually met with the team that are producing the carers assessments, working with autistic people and the social workers to update their system to make sure that it is autism friendly or actually, let's just say friendly. It's a friendlier version of a carers assessment, which is so desperately needed. But to actually have the local authorities meet with us and do this is just incredible. It shows us that they are listening and taking on board all of the feedback from the project. Overall, 404 professionals engaged in the project. That is because of the webinars were recorded and put on YouTube. So I've been tracking how many people have logged in and then watched the videos on YouTube. So we were able to ascertain how many people watched it overall. So far, professionals have received 323 hours of support during the project for the webinars. So we're absolutely delighted to have been able to deliver that many hours of professional support and guidance to make sure that professionals are supporting autistic carers better. The next page, please. Lovely. So this is just one of the workshops on YouTube. As you can see, I just wanted to give you guys a bit of a taster of what it looks like on the YouTube channel. So understanding and recognising sensory needs and how they can impact daily life. And that's because we want to make sure that when that carers assessment's happening, they understand what that actual day would look like for someone who's autistic and how you break it down, the questions you need to ask, what's going to impact that day, what might impact that person when you see them when you're doing the needs assessment. So that was an extremely popular one. That was our second one. Our third one was on how to make reasonable adjustments. And the first one was understanding how to support autistic carers through the needs assessment process. So been phenomenal. Oh, I've actually updated this since. So all 3 webinars are now on YouTube and ready to go. It went up last night. On top of the hours that were provided during the sessions, actually live, we've also had another 48 hours worth of support online, people watching the videos, and then 77 additional views have taken place since the videos were actually made live. So yeah, I just wanted to help people understand that these workshops, the kind of the sustainability long term is huge. These are going to go on our website, and I've been speaking to various carers organisations across the UK who are embedding these into their website. So this work isn't just about what's right now, it's about how it's going to impact for the next couple of years. Yes, things will change, but right now we're going to reach even bigger audiences than just the people that we're seeing. I'd love to be able to go back and monitor this in 12 months time and come back to you and be like, so actually we had an additional 1,000 views, and to actually be able to break that down into the hours of support that professionals have received since. So that's great. If we could move on to the next slide. Lovely. So I also just wanted to share some of the feedback with you from professionals, because like I say, it has been exceptional. The fact that local authorities have reached out to us and actually asked to work with us so they can update their assessment has been huge, but also what some of the professionals have actually gotten out of this. I'm not going to read it for you all down, bit by bit, but if I could just ask you all just to take a second or so just to kind of think about some of the words here that we're using, that would be fantastic. But I think the big one at the bottom, that actually came from a social worker. It reminded me about reasonable adjustments when I'm working with people. And that says to me that we aren't upskilling our workforce to necessarily have the knowledge, or making sure they've got those basics in place to support the community as they should be doing. But yeah, the next slide then, please. So obviously off the back of this, there's always an ask for more. And I asked people what they wanted and how we could continue to work with health and social care workers to influence how workforce changes and shifts moving forward. So supporting autistic carers when they're struggling with mental health. We know that that's a big issue. 3 out of 4 autistic people struggle with mental health at some point in their life, which is a much higher proportion of people that are than those are that aren't neurodiverse. But if you've got a carer's responsibility on top of that as well, we need to make sure that the right support is going into place. So support to improve communication to support an autistic carer. That for me is a huge thing to admit. And that was a regular response that we were seeing coming through from professionals, that they didn't know how to communicate with somebody who was autistic and a carer. They wanted to learn how to do it, but they needed the support to do so. And then understanding the different types of support that's available to autistic carers. Now, within the East, we're quite lucky because you have Autism Bedfordshire and there are other organisations like ACE Anglia who provide that support. But across the country, I reckon that other than NAS, not many of us could name more than a handful of agencies that support autistic people without a learning disability. And it's really, really important that when health and social care workers are supporting people, that they have access to the right resources and are able to make appropriate referrals so that both the carers need and the autistic need is supported, because without both being well balanced, the other one's going to sink, and we don't want that to happen. We want to be able to support people as much as possible. So those are the 3 areas that people were keen to hear more about. So yeah, that kind of really takes me to the end of the presentation. I really just wanted to give you all a snapshot around the numbers and the feedback that we were getting from the work that we were doing. I do appreciate it's quite niche, but does anyone have any questions or want to hear more about anything I've just spoken about?
Thanks, Shanna. That was really good. Thank you very much. Fantastic piece of work. I think it's always important to have professionals attending, these workshops and webinars, and for them to realize that they need to make reasonable adjustments for people with autism. And it's not just a tick box exercise, is it? Sometimes people do tend to forget the actual need to be proper co-production when it comes to this kind of thing. So no, thank you. I don't know if did I link you in, or me and Verity, did we link you in with the autism program within NHS? I think we talked about it, but I'm not sure if we did in the end. I'll pick it up with Verity later.
I'm linked with a lot of programs in the NHS for autism, so I don't want to say no and then it turns out I'm actually in the steering group.
You probably might have done, because I've seen Aaron Senior and David Gill attending some of your webinars, so you might have at some point. So I'll double check with them anyway, because they're the autism advisors within they've got autism themselves, and they're autism advisors within the program. So I'll double check with them.
Lovely, thank you, Steve.
Yeah, no, it's all right. Awesome. Any questions for Shan? Please put them in the chat box. And we can pick them up as we go. The next presentation, Elizabeth, are you online? It's caring for carers from Asian communities. What works?
Yeah, can you hear me?
Yes, I can see you. Yeah.
Great, thank you. I'm going to talk to you about what we've been doing over the last year, but also take you back a few years to where it all started from as well, because I'm conscious this is the last sort of get together before the end of this particular section of the project. So could I have the next slide, Steve, please? We decided to call ourselves Asian Carers United, and it's a group of Asian carers that we're working with. Can I have the next slide, Steve, please? Oh. I'll just read, because I have got it printed out. So this was a little bit about called Wraparound Partnership, which we set up in 2014, mainly to work with families of children with disabilities and special educational needs. To date, we've supported 2,500 families across mainly Greater Manchester, but we support with education, health care, housing, any sort of issues that they come up with. We work with families in a holistic way. Passion is for supporting families from underrepresented groups. Can I have the next slide, please, Steve? Sorry, I'm not sure if I'm talking too loud or too quiet. I'm not used to using a microphone. It's just because we've had our event today. So please tell me if I'm talking too loudly or not. So Greater Manchester Integrated Care Partnership, just a quick whistle-stop tour. It involves 10 local authority areas, and we've been working across all 10. I've been involved in the Carers Partnership Board since 2018. We have a Carers Charter. So the issue around carers and support for carers more widely has been ongoing since 2018 and even before then. So one of the subgroups of the Carers Partnership Board is carers from ethnic minority backgrounds, which again is one of the subgroups that this work feeds into. Next slide, Steve, please. Okay, from during during lockdown actually, and there was some funding left over from a very small amount of funding left over to do some qualitative research with how families from Asian communities and ethnic minorities were finding lockdown in general. So we undertook a lot of telephone questionnaires and spoke to a large number of people to find out how they were finding things. And it wasn't, a very intensive project, but it certainly got me personally thinking about the experiences of carers from Asian communities. They're not front and center of people's thinking when they think about carers. And also, many of those conversations were around the stigma attached to caring and the caring role within the Asian community that is quite often just seen to be the responsibility of families, and how families generally don't ask for additional support beyond what they're providing from other statutory services. Next slide, please, Steve. Okay, so in 2021-22, which was last year, we started working with a small group of carers from the Asian community, all women, from different parts of Greater Manchester, interestingly enough. And these were the aims. We wanted to understand how to help carers from Asian ethnic backgrounds identify what matters to them, to understand what adjustments need to be made to encourage carers from Asian ethnic backgrounds to access support. Goes back to what I said before about the stigma attached to that and the automatic assumption that families are going to do the caring. To co-design recommendations with carers from Asian ethnic backgrounds, and to develop a Greater Manchester Asian Carers Network, which we've made quite a lot of progress on today, actually, which I'll tell you about in a minute. Next slide, please, Steve. Thank you. So what did we do first? The first thing, we spent about a month or so pulling together a directory of organisations, and that includes voluntary community social enterprise in each local area. It was a hard slog. It involved going a lot of the time through Facebook as well, because some of the smaller community-based organisations only have Facebook pages, they don't have a website. Sometimes you got sent off in different directions and you came up with just a phone number for somebody who works in that area, in that locality. There was an awful lot of legwork, and it also it requires updating regularly. So I think we're on about 25 pages now of different organisations working within Asian communities. That includes mosques, temples, and so on. We have weekly online meetings, and we have a stable core group who are actively engaged. We've built up some good relationships, and again, we'll talk about that when we get to the end. So thanks, Steve. Could I have the next slide? Okay, so I don't know why the slides haven't come through properly. I apologise for that. So the identified themes from the work that we did last year were things that needed addressing were awareness raising, information and advice, the need for improved social networks, and communication and respect. The awareness raising is one of the things that we've focused on today, because we've had a big event today. First of all, it's okay to ask for help, tackling the issues related to stigma attached to caring, challenging and positions that loved ones who require care are solely the family's responsibility, and an annual celebration event where we can talk about experiences and share information. So those were the themes that were identified at the end of last year's project. Next slide, Steve. Thank you. So this is mainly what I wanted to share with you today is today we've had our first Asian Family Rights Day 2023 here at the British Muslim Heritage Centre. It started at 9:30 and it finishes at 4. But as you can see, most people have gone because we decided that there'd been a lot of them had set up at 8:30. And actually, when we had the question and answer session between 1 and 2 today with people, senior leaders from the GMICB, there was a lot of people that attended for that and had specific questions for those leaders. So we've had 16 different organisations present today, the DWP, Health Watch, commissioners from primary care across Greater Manchester, because we had a number of questions from carers asking about how to register with a GP if they've only just moved into that locality, and a lot of them needing support with interpretation and also filling out online forms. So we had iPads and laptops and things here as well. We've had representation from small community groups, Caribbean African Health Network have also been here, and it's gone really well. I'm really pleased with how it's gone. I think it was interesting to, and these obviously we've only just finished. My initial thoughts are that it was interesting to have a whole range of different organisations in the room, and in fact the organisations themselves said that they don't regularly get together, so there was a lot of conversation between carers organisations and the DWP, for example, or primary care don't often get out and speak to carers organisations either. So I'm going to reflect on that, but also, you know, I have got a sign-in sheet somewhere which shows how many people have attended. We've got questionnaires and things that I will go through and will form the outcome of our report. So the establishment of the Asian Carers Greater Manchester Network, that's happening. There's more and more people that want to be involved, even from today, that have said they'd like to be involved now. So we've set up a WhatsApp group and we meet regularly once a month to look at what support is necessary across Greater Manchester for carers from the Asian community, and we had a really positive engagement from the senior leaders from Greater Manchester ICP this afternoon. Lots of actions and outcomes for them to take away, lots of questions about thinking outside the box, so not just thinking about carers in terms of can they access respite. Yes, they might be able to access respite, but is it appropriate? Is it culturally appropriate? And how do we overcome the stigma attached to caring within the Asian community? So it was a really, really great discussion, and I'm really pleased with the outcome of that. And you know, once I've had time to reflect on how today's gone, then we'll take it forward. I think one of the comments from some of the people today was that perhaps we need to take it smaller and go into each local area, and maybe have it centered around a mosque, community groups, or somewhere like that in each local area, so that we are trying to get out to what's called hyper-local places where people can meet. Can we have the next slide, Steve, please? Okay, so because I'm part of the Greater Manchester Carers Partnership Board, I am going to put a business case together. So, and I think the project needs to have some investment for a good period of time, not just, you know, bidding and having it run year on year on year, but say 3 or 5 year investment. We're definitely continuing with the Greater Manchester Asian Carers Network. Want to focus on having a paid role in each local area, specifically to focus on the needs of carers from the Asian community. And it has been a privilege to meet and work alongside those wonderful people. I've actually made some really good friends, keep, you know, in touch with each other, because some of them I've been meeting with every week for 2 years, and that's been really good to keep up with things like that. So thank you for that. Is there any questions? I'm conscious that I've just rambled through it rather quickly, but if anybody has any questions, please just let me know.
I think Sigrid, are you on? If you want to add the comment, just speak about the comment that you've put on into the chat box. I'm not sure, Elizabeth, if you've seen it.
Yeah, well, just to say that I went to the event in the morning, and it was just a really good atmosphere. They're really friendly, and was really great to meet people face to face. And as you just mentioned, Elizabeth, like for myself, for example, I didn't really have a lot of chances before to meet people from care organizations in Manchester face to face, etc. So that was just really lovely. And yeah, I think the people there, they felt welcome as well, and were able to make connections. So that was great. Thank you for organizing that. It was a really good event.
Yeah, if you've got any outcomes from the day as well, Elizabeth, please do share them with us, and we can share them on our platform.
Great, thank you.
Thank you very much. Any questions for Elizabeth, please put them in the chat box, or hold on to them until we get to the question and answer section. Thank you very much. And the final presentation today will be from the North East and North Cumbria ICS with Claire Gamble, Karen Shaw and Karen Grande. Are we online?
Yes, we are. Good afternoon, everybody. Is Claire Gamble, Community Project Manager at Catalyst Stockton, and our engagement, consultation and co-production with refugees, asylum seeker and migrant communities in Stockton-on-Tees is co-produced between ourselves and Stockton Borough Council, as well as the local community. So if we can move on to the first slide, please. Oh, sorry, next one. So I think I've repurposed this from my original presentation, and I won't talk too much, conscious that I'm the last one presenting, and the barrier between everybody getting off and getting on with their jobs. So for those of you that have seen it before, I'm not going to talk about it in too much detail, but as I mentioned, we are based in the northeast of England with a population of 200,000 people. Our work has been with 24 different organisations that operate within the refugee and asylum seeker support services. And if we can go on to the next slide, I'll explain a little bit about how we've done that. So all of our work centred around a steering group, which was made up of partners from the voluntary sector, the local council, other public sector organisations, and also our adult carers support service, which is one of the departments within the local council. Our work has focused originally. Our original intention was to run focus groups and workshops to better understand how we market and market our service to the refugee and asylum seeker community, and how we then involve them in the co-production of our marketing materials and understanding their service needs in order to bring them help them access the service. Now, what we did, I think, at the time of the last event, we were just about to have our workshop and focus groups, and I am not so pleased to tell you that did not go so well. I think what we found similar to other groups is that actually what we needed to, we found attendance was quite low. Very few of the community groups were actually able to attend for multiple reasons, and so we went back to the drawing board and decided that micro geography was needed. We went out specifically to the different groups and engaged with residents directly where they live, rather than asking them to come to us. And we found that that was much more productive. We were pleased to, and I think I mentioned on our last learning event, we were really pleased to get somebody from the refugee and asylum seeker community on board with our project, but really bringing in that lived experience as a paid project coordinator for this specific project. And actually the benefit that brought to our understanding of the communities that we are trying to reach was phenomenal. I think I think we're almost ready to feedback in terms of the engagement that we've had and what our findings are, so that we can really progress that progress the work that we've been doing just as we come to the end of the project, and hopefully moving forward for a long time. So that is where we are, and I'm happy to answer any questions.
Thank you very much, Claire. Short and sweet.
Absolutely.
Any questions for Claire at all? I think you did touch on the low of attendance on your workshops and webinars. It's one of the most common themes that we've picked up in terms of the interim reports that came back. So we'll be touching on that when we go through the issues and what is working well within what's been reported. Is there any comments or any questions for Claire before we continue? Silence is golden, it is, isn't it?
Excellent.
You're getting off lightly here,
Everyone
Claire.
wants to go home, that's what it is.
Okay, we'll just carry on to the next item, which is basically the issues that were raised and what is working well. So what we've gone and done is we've basically just put them in themes. And if I can just go down through the list just to tell you of some of the things that we found out. One of them was sustainability, which was basically based on the changes to service delivery model post 2023. Most people saying that it will be very difficult in terms of sustainability. Then the next one is families not seeking help because of the stigma attached to it. I think this was mentioned earlier on within the armed forces presentations and those of the drug and alcohol misuse carers as one of the common themes. The other one for young carers is young carers not willing to actively engage, again, due to some of the stigma attached to it. And the other one is COVID delayed delivery plans for some of the projects. And carers struggling to attend workshops due to caring responsibilities. I think the most interesting one that we have in terms of the armed forces infantry and carers is the possible squadron closures. Does everybody feel like that's one of the common themes? Because I think we've picked up on two of the reports that highlighted that some of the squadron closures were affecting some of the attendants or reaching to reach the carers. Has this been something, Chris? Because I'm just saying Chris because you're writing in front of my screen.
Sorry, some of the closures of.
Oh, you're breaking up, or is it just?
Sorry,
some of the squadrons are being shut down, so it's been difficult to get people to attend any sessions or any workshops.
It hasn't been a specific problem for us, because I suppose a lot of our project is focused on veterans and their families rather than the serving personnel.
Yeah.
But it's not like we haven't picked up serving personnel. In fact, during the meeting, I've just had an email from a colleague who's got some responses back from a Marine who's caring for his wife who's got mental health needs. He's serving personnel. But what we do know is it's quite a challenge, full stop, engaging with families whilst they're in service. Even the welfare units we work with, so these are sort of like support teams funded by the military to support families, find it difficult engaging with the families, partly because I understand that there's stigma attached to it.
Yeah, thank you, Chris. I think Katie, you had your hand up.
So I understand why Cheshire experience those problems.
Yeah, I was just going to follow up by. I was just going to follow up saying that we're specifically targeting at the moment the carers of veterans linked to our Ops Courage services. So that's not an area that we've really explored. So we couldn't really comment on that. But the point about sorry, I'm coughing out of nowhere. The point about the time that carers have to get out to attend things is obviously a common challenge that everyone has. Hence why we've tried to do the kind of digital podcasty type approach, but
yeah,
not at the expense of face-to-face, only as a complementary thing, hopefully.
Yeah, of course. But in terms of technical in doing them onto Teams or Zoom, have you not experienced any? Because they, carers sometimes have this digital poverty in terms of them accessing, tablets or laptops or computers or anything like that. Have you not experienced any issues around that?
I suppose the dilemma with the way that we're doing it is you're not going to know if they can't access it, they're not going to be able to access it. You're not going to capture that information, are you?
You can't. No.
But I think we were just trying that approach based on the information that we had from the original focus groups that we had, because people said a variety of different mediums and ways of doing it was things that they found helpful, and also that led to the sustainability piece, like you were just saying before. So we were hoping that, like we did about the kind of films to do the psychoeducation kind of learning, that they could be on a website or something that people could go back and look at them afterwards, so that you have got a bit of sustainability built in there, rather than having somebody deliver it each time, because you wouldn't necessarily have the resources to do that.
I agree. Any comments from anyone on that?
I was just going to add that we've developed like a range of offer to our carers. So we have online, we have a newsletter, we've got a fortnightly blog. We try and reach out to carers all different ways, because different carers respond better. Some people, particularly the older carers, enjoy newsletter, don't they? Popping through the door. And we've tried to deliver online. We do Zoom training. We found Zoom is a lot easier for older carers in particular to understand than Teams. So it's a case of just trying to reach out and do as much different sort of engagement type of activities as possible. We have support groups, and because our geographical area is the whole of Cheshire West, and because of carers' caring responsibilities, we can't always offer something that's accessible in a location to everybody. So sometimes if we're putting a workshop on, we'll have to replicate it 3 or 4 times across the county, so that everybody's got, equal access to it.
I totally agree with that, and that's the approach we've been trying to take with things. The more variety and different ways that you can try and share the information or attend things, the better, because everybody's so different, and they can take the opportunity then to pick what works for them, can't they?
Yeah, we were quite fortunate that at the start of lockdown, Cheshire West and Chester Council decided to distribute, it was something like about 500, 600 iPads to carers. That brought technical difficulties to a lot of our carers as well, because they were given a tablet and not sure how to use them. And obviously during lockdown, they couldn't call in the grandchildren to get them up and running. So we've tried to kind of upskill over the telephone, and we've found bit by bit people have, you know, come on board with the iPads. So it's been sort of, you know, slowly but surely our numbers of online engagements increased. It's one of them things, isn't it? It's a slow burner, getting people up to speed.
I think probably it's one of the things that COVID has contributed to in terms of, you know, the older carers, and some of the carers have had to upskill the you know, in terms of accessing Zoom or Teams to be able to access webinars and meetings. So that's a positive out of it.
Yeah,
Yeah.
definitely a catalyst. But I think there's that interesting point about, like, my parents are in their 80s and they can just about understand a Zoom or do it, but they still don't like doing it. So if there was an alternative, they prefer the alternative. So there's that balance as well, isn't there, between a preferred one and actually your ability to do it.
Yeah, we had a little bit of funding to deliver some online baking during lockdown, which was really good for carers who could come along to events, you know, due to their care and responsibility, and particularly for some elderly gentlemen who had never had access to the kitchen, for example, until the person that they care for, like namely the wife, had become poorly, and then they suddenly had this access to this area that they'd never been into before. So we had gentlemen trying to bake all sorts of things. So they were balancing mobile phones and iPads and stuff on windowsills. So that was quite good. And that's just kind of a way of teasing people out, isn't it? And once they've tried something and it's been quite successful, then they're more inclined to join an online workshop where they're going to learn something relevant to the caring role. So sometimes you have to do something a little bit kind of bit fun, don't you, to try and tease people in, you know, trying this new technology.
Great. Oh, thank you for sharing. Does anyone have anything that want to add on to, or mention any issues that they're facing that they feel the group might be able to help them solve? I think everybody's just ready to call it a day, aren't they?
That's a huge tall order though, that, Steve. I mean, you could just solve my problems for me.
I know.
On a Thursday afternoon, Wednesday afternoon, I got even the days wrong.
Okay, I'll just touch quickly on what has been working well. I think some of the big three items that came up were collaborating with the ICSs, and including voluntary sector organizations. Then there was also the positive engagement and feedback from carers, professionals, and the volunteers. And another big thing was the building good, solid, and trusting relationships with group members that are attending the workshops. Has anyone got anything else to add? No. Okay. I'll just touch up on our next steps. So we've got the 10th of March, which is the date that's been set for the sites to submit your final reports. So if you can just make sure they are with your regional leads by the 10th of March. I think these dates are in your calendars now. And I think we've also got, and if you need any templates or anything like that, please just let me know. But I think I've sent the templates to you, but I can do that again after this call, just to make sure you've got the final reporting templates. Then on the 21st of June, we are planning our celebration event. So basically we are hoping we'll be inviting external people. It will be open to carers, voluntary sector organizations, and anyone who's willing to attend. So we're going to set up a link where people can register for the event, and I'll be able to share that with you. If you want to share with your networks, please do. I think last time we had about 300 people attending, so this time around hopefully we'll get more. It's your time to shine, you know, present your works to the people. So yeah, anything else that we might need from you guys, I will send you an email, especially in terms of the celebration event. I will send you an email regarding how the day is going to run, and if we're going to have any breakout rooms or anything like that, I will let you know. Yeah, and that's it from me. I don't know, we've got regional leads on the call. Do you want to say anything regarding the presentations today? I know Jodie's online, Debbie's there, Sigrid. Do you guys want to add anything? Jodie, yeah. Are you there, Jodie?
Sorry, my Wi-Fi is really slow, but and now I'm talking really slow, so I'm just keeping my face off. But I just wanted to say just how positive that Shana's work from Carers in Beds about the autism carers has been received within region, and also how it's been shared nationally. I think having the person who's delivering the project, having those links with the carers lead enables those contacts throughout the region. So more than the integrated care system that they're in. So Shana's been linked into the local authority, the carers local authority organisation, the learning, or the autism one as well, and we've also been able to link her in with Carers UK as part of their work. So it's been really impressive, that ability to share. So I just want to just say, you know, their work has just been amazing and really given some unique insights that we haven't seen before. So thank you, Shana, and thank you, Autism Beds, and all your team.
Thank you, Jodie. Anyone else? Any of the regional leads online would like to say something else? No. Okay. Anyone else who's got a question or anything they would like to share with the group before we call it a day? 10 minutes before we are actually supposed to finish. Helen?
Hi. Yeah, I just had a really quick question, if that's all right, for Elizabeth. I know you touched on it a little bit earlier with the event that you've had today and the questions and answer session, but I just wondered if there was a bit of a theme around some of the questions that were asked at that event today, or it's probably a bit too early to evaluate, but I just wondered if there was anything interesting that had been asked. Elizabeth might not be online.
Let me see if she's still online. Elizabeth, are you still on? I think she was having technical. Yeah, it looks like she's dropped off actually. Yeah, we can always pick that question up with her after the call, Helen. Yeah. Thank you very much. So please do send me any questions you might have. Please do let me know. And like I said, you know, if you've got any resources and if you've got any of your events coming up, we're happy and glad to share them via our platform, which so far we've got over about 600 people on there. So please do send any flyers that you might want to share, and we can upload them onto the site. Having said that, have a brilliant rest of the day and enjoy the sunshine. Leeds is like Costa del Bravo at the minute, so going to enjoy the sunshine.
Thanks, everyone. Bye.
Have a good day, everybody.
Bye.
Bye, thank you.